Hi there. Welcome to another episode of Pharmacists Online. Yes, yes, I know it's been almost 1 year since I've last posted a video. Let's just say it's been a really hectic 1 year. Anyway, today's topic under discussion is diabetes mellitus or sugar diabetes. It is a topic that I identify with very closely simply because my late grandfather had diabetes, my father has diabetes, and it is an ailment that has basically affected thousands of people across the globe. In today's discussion, I would tell you more about the causes of diabetes, the symptoms, the types of diabetes, the treatment utilized to treat diabetes, as well as the lifestyle modifications. So let's get started. Diabetes is basically divided up into two classes. We get a type 1 diabetes, also known as an insulin-dependent diabetes mellitus. This is basically caused as a result of your body's autoimmune response, whereby your body starts attacking the cells in the pancreas that actually produces insulin. Now, insulin is a very, very important hormone in our bodies that basically converts excess glucose in the bloodstream into glycogen, which then gets stored in the liver. In a type 2 diabetes, normally known as a non-insulin dependent diabetes mellitus, we find that there is simply an increased resistance to the effects of insulin. Type 1 diabetes generally tends to occur in your kids or teenager populations, whereas a type 2 diabetes generally tends to occur in your adult population. What are the symptoms of diabetes? Very important symptoms include thirst and increased urination. Now, when your body has an excess amount of sugar in the bloodstream, it basically draws out fluid from the cells. That causes a person to become dehydrated, which means we start drinking more fluids, more liquids, causing us to go to the loo more often. Other symptoms would include blurred vision, weight loss, extreme hunger, as well as severe fatigue. Okay, these are some of the major symptoms associated with diabetes. Now, what are the risk factors associated with diabetes? Some of the risk factors would basically include the following. If you have a family history of diabetes, basically genetically, it obviously means that you have an increased chance of developing diabetes later on in life. In one interesting study that I basically came across, it found that with regard to geographical location, there was an increased risk of a person developing diabetes the further they basically traveled away from the equator. Other risk factors, if you have been exposed to Coxsackie virus, mumps, Epstein-Barr virus basically as a child, it could trigger an autoimmune response for your body to start attacking the pancreatic cells that actually produces insulin, which obviously increases the risk of the person developing diabetes. Now, omega-3 fatty acids, vitamin D, seems to sort of lessen a person's chance of actually developing diabetes. In another interesting study, I found that if a child starts drinking cow's milk at a very young age, you could be increasing that child's risk of developing diabetes. Also, if the child has been born jaundiced or developed a respiratory infection immediately after birth, also increases the child's risk of developing diabetes. Moving on, what are the complications of diabetes? Right, some of the complications would include heart and blood vessel damage. Most patients who have diabetes would develop an angina or an atherosclerosis, which is the narrowing of the blood vessels, and that would eventually lead to a full-on heart attack or a myocardial infarction. Other complications, basically very important, are nerve damage. Now, sugar basically injures the walls of the tiny blood vessels that basically provide nutrition and nourishes the nerve cells, especially in the legs or the extremities. And this causes patients with diabetes to feel numbness, burning pain sensation, or a peripheral neuropathy or a tingling sensation in the extremities. I recall this, with my grandfather, where eventually he basically lost all sense of feeling to the point where he placed his legs, his feet on a hot heater, and he couldn't actually feel that his feet are burning. Okay, so this is what happens in a diabetic. Kidney damage. Kidney damage occurs very frequently. Your kidney is a very unique organ that is made up of tiny blood vessels, blood capillaries, creating a unique, beautiful filtering system. And with diabetes, we found that patients develop renal failure, likewise blurred vision, blindness, because of the damage in the blood vessels or the blood capillaries in the retina of the eye, causing a diabetic retinopathy. People with diabetes are obviously prone to more skin and mouth infections, especially fungal infections, because fungi or yeast thrive in conditions where there's a lot of glucose. It is very important that if a person has diabetes, there should be an extreme amount of foot care. Okay, they should go to a podiatrist for proper foot care, simply because um, if there is a blister or a sore on the foot, and if they get cut, it is not going to heal very well. The chances of that infection spreading is very, very, very great, simply because there is a poor blood flow to the extremities along with nerve damage. And if the infection spreads eventually, it would turn into gangrene, and a leg or a foot amputation would be required. People with diabetes or diabetes itself tends to lower the bone mineral density, leading to osteoporosis. That's another complication associated with diabetes. Obviously, if a woman um, is pregnant and she has diabetes, there is an increased risk of her miscarrying, developing a stillborn baby or a baby with many, many defects. Along with the diabetes, she could also develop a preeclampsia or high blood pressure